All right, so today I'm going to continue on with the digestion PowerPoint. Last time we talked about colorectal cancer, which is one of the more severe types of cancer that you can get. It typically metastasizes to the liver and can be caused by your diet, things like alcohol. I said before, different types of meat, particularly those that contain nitrates or nitrites, so a lot of the lunch meats. You have a lot of bacteria, particularly in your colon, which is one of the main places where GI cancer occurs. It's called typically colorectal cancer. So what happens? You can get all sorts of irritation and stimulation of the mucosa, which can stimulate genetic mutations that occur within the cells lining the GI tract, which then also stimulates the immune system. Those cells, and if the immune system can't recognize those cells as cancerous and the cancer then starts invading, that then can be a serious dilemma. So the next organ that we're going to look at is going to be the liver. Now the liver does a lot of things in addition to producing bile, so it processes all of the foodstuffs that we get within our diet. So it processes the carbohydrates, it forms glycogen, it also can convert substances into glucose, so it's one of the main organs where gluconeogenesis occurs. The liver processes fat, it makes all the different lipoprotein particles, including VLDL, which it secretes into the circulation. We'll talk about other functions of the liver besides processing the nutrients. It produces a lot of proteins, including the coagulation factors. It makes substances like angiotensinogen, which we talked about in the renin-angiotensin-aldosterone pathway. It can create heat shock proteins. So it does a lot of things. I think if you Google it, you'll find that the liver potentially has over 500 functions. So one of the major functions is actually creating serum albumin. And serum albumin is really what gives the blood its oncotic pressure, or a lot of it. So remember that the blood differs from the interstitial fluid in the concentration of protein. So if you get liver disease, like what types of patients get liver disease? It can be alcoholics, so that can cause cirrhosis that causes the liver to become dysfunctional, and that leads to ascites, where your belly can literally fill up with fluid. So the fluid is because of the decrease in the protein content in the bloodstream. To maintain your blood pressure, you actually have to increase your fluid volume, particularly in the interstitial fluid. Remember that the largest compartment of fluid in the body is within the cells, the next largest is within the interstitial fluid, and the smallest is actually within the plasma itself. So the liver does a lot of functions. The digestive functions, processing carbohydrate, fat, and protein. It also filters bacteria, it gets rid of those, so it plays a role in the immune system. And it produces bile, and the main function of bile is to emulsify fat. So bile has a component that has both hydrophilic and hydrophobic portions, so it's amphipathic. So it's able to emulsify the fat, going from one large particle to many thousands of smaller particles that allow the enzymes that have been produced in particular by the pancreas, or even found in saliva, like the lipases that are found in saliva, to perform their function much more easily. And if you've got issues like with gallstones that prevent the bile, potentially if you have a blocked duct that transfers the bile into the GI tract and the small intestine, you can actually start getting problems with fat absorption because the bile can't make its way into the intestinal tract and it's not able to emulsify the fat. So that causes much fat to remain within the feces. So if you have a bowel movement, the feces can literally float on the top. It starts appearing more whitish because of the increased fat content. So the liver does a lot of things, and one of the only organs in the body that is capable of regeneration is actually the liver. All right, so the liver cells themselves, you have two different types of cells. Those cells that produce bile, that literally send their substances into the bile canaliculi, that then send that into the gallbladder for the bile to be stored. The other cells in the liver detoxify a number of toxins like alcohol, drugs, and that literally is found in the microsomal fraction of the liver, which is components that contain the smooth endoplasmic reticulum. Remember I said that the blood from the GI tract goes from the capillaries that are found in the intestine and the stomach to the hepatic portal vein. Then you have the capillaries in the liver. So the liver literally is a portal system where you have two capillary beds in a row. The first capillary bed is in the GI tract. The second capillary bed is in the liver, and that allows the different substances to make their way to the liver for processing. So the liver actually gets 80% approximately of its blood from the portal vein. The other 20% comes from the hepatic artery. So it's one of those organs that gets more deoxygenated blood than oxygenated blood. All right, so this just shows what's called the portal triad, where you have the central vein coming in, you have various cells that get the blood from the vein, so all of the blood coming from the GI tract. You have the other cells that literally make the bile, and that is then excreted from the liver via the cystic system so that it goes into the gallbladder. All right, so this is a good diagram showing all of the different areas of the GI tract and the blood that is coming from the capillaries going in to the portal vein, and that then goes to the liver in the capillaries that then allow the cells to get all of the nutrients that you've absorbed. So the liver and the kidneys are two of the main organs that help you to detoxify drugs and to get rid of substances. Typically the liver also serves to allow substances to be made more soluble in water, so it modifies different substances so that they can be excreted by the kidney. So this is a blurry picture that shows when the liver gets cirrhotic, you can actually get increased back pressure in the portal vein, which causes what's known as portal hypertension. So you can literally start getting increases in the size of veins in the stomach, within the esophagus, as well as within other regions of the GI tract that can literally start bleeding. So physicians in patients who are alcoholic and have cirrhosis, in many cases, those patients have GI bleeds that are caused from these esophageal and gastric varices. And when they bleed, the physicians have to go in and stop the bleeding, and they can typically do that by inserting a tube down and literally sclerosing the veins so that they no longer bleed. and they can do that with various substances like alcohol or even cauterization. So alcohol is particularly toxic once you get above a certain dose. So typically they categorize alcohol in unit consumption, and typically a unit of alcohol is like a shot glass, so an ounce of alcohol that you drink. So if you get over 20 of the units, you start seeing an increase in the incidence of cirrhosis, even seizures, esophageal cancer or other cancers of the GI tract. Even breast cancer can increase with increased alcohol consumption. So the liver blood supply, as I said, 75–80% is coming from the portal vein, the other 20 to 25% from the hepatic artery, so it's relatively unlike any other organ in that respect. The blood supply of the hepatic artery, it gets more than enough oxygen to be able to do its job. As I said, carbohydrate, fat, as well as protein metabolism. The only fats that the liver directly gets from the portal vein are the medium and small chain fatty acids. Anything larger than, say, 15 to 16 carbons is going to be packaged as chylomicrons within the intestinal cells, and that then gets excreted into the interstitial fluid, and the lymphatic system picks that up, and it then gets dumped back into the venous system, where the triglycerides and other components found in the chylomicrons can either be delivered to body tissue like fat tissue or even muscle tissue, and the chylomicron remnants then get internalized by the liver. All right, so this just goes through the carbohydrate metabolism. Remember, I also said the liver can undergo or create glucose from gluconeogenesis. It also can store glycogen. Typically doesn't like to store fat, but as we saw before, if your diet has too much fructose or alcohol, the liver gets inundated with fat, which can literally cause the immune system to get angry, and your liver starts undergoing inflammation, which is typically known as hepatitis. So previously, little children never used to get problems with their liver before fructose started to inundate our food supply. Then they started to develop fatty liver disease, which can lead to hepatitis, and ultimately that can progress to cirrhosis. So 18-year-olds are more commonly getting liver transplants than ever before. 30 years ago, that was never seen. These days, it's a common phenomenon, which is totally related to the increased consumption of fructose as well as other substances that children are constantly exposed to. So fat metabolism, it's extremely active in oxidizing triglycerides. The major form of lipoproteins that are synthesized include VLDL, but you also get production of HDL as well. The liver synthesizes large quantities of cholesterol as well as phospholipids. Protein metabolism, you get synthesis of non-essential amino acids. Remember, the definition of an essential amino acid is that you have to get it in your diet. All right, so removal of drugs and hormones, production of hormones. Another hormone that gets activated in the liver is vitamin D. So vitamin D is normally produced in the skin in an inactive form. That then gets converted to the active form in two organs, the liver and the kidney. The kidney hydroxylates it in the one position. The kidney skip that. The kidney hydroxylates it in the 1 position, the liver hydroxylates it in the 25 position. So active vitamin D is known as calcitriol, or 125 dihydrovitamin D. And that has to do with calcium metabolism, which we'll talk about more in an upcoming chapter, I believe, maybe chapter 23. So bile is produced. So bile is a breakdown product of red cells, so bilirubin. So you have deoxycholic and chenodeoxycholic acid, which are amphipathic materials, so it helps to enable the solubilization of the micelles, so you get production of many small micelles that enzymes that are produced by the pancreas can then be able to get into and digest the fat. Liver also functions as storage for vitamins as well as the fat-soluble vitamins like D, E, A, and K. It also stores vitamin B12 and minerals like iron and copper. So in my day, they always told you to take cod liver oil because of the number of vitamins. And the liver is also capable of getting rid of bacteria. So there are a number of phagocytic cells. The Kupffer cells can help phagocytize bacteria, as well as even worn out red cells and white cells. So the spleen has different pulp, the red pulp and the white pulp. The white pulp in the spleen deals with the immune cells, and the red pulp deals with getting rid of the red cells. The liver also participates in that as well. So the activation of vitamin D I just talked about, so the organs involved in that include the skin, the liver, and the kidneys. And as I said, it helps to regulate calcium metabolism. So the gallbladder is the area or the organ in the body where you store bile. It concentrates it, and when fat hits the small intestine releases the hormone cholecystokinin. And cholecystokinin